What if the Allspark was no longer on Cybertron?
True peace, Kens, Moderna's COVID-19 vaccine causes monsterism. First it was the black goo, now it's monsterism. Peep the slang. Moderna's COVID-19 vaccination, which the Food and Drug Administration (FDA) approved on 8th of December, may cause recipients to experience an extremely rare but potentially lethal side effect, monsterism, a degenerative disease that ravages a victim with physical and mental deformities. A Moderna whistleblower speaking under conditions of anonymity for fear of retaliation said 3 of the 3,000 trial candidates began showing symptoms of the horrible disease shortly after receiving the second dose of the two-part vaccination. Since half of all volunteers were given a placebo, the true number of afflicted was 3 in 15,000, or 0.02%. And while that figure might seem statistically insignificant, it is critical because our source said Moderna concealed the unintended side effect from both the FDA and the volunteers who had not yet received the second inoculation. The U.S. government sponsored Moderna's vaccine to the tune of $1 billion. The first systematic victim telephoned Moderna 2 days following the vaccination. He complained of headaches, nausea, unusual body hair growth, and upper abdominal postprandial extensions. A Moderna representative assured him the symptoms were normal, and nothing to worry about, but instructed him to seek medical attention at a local emergency room if symptoms persisted into the next morning. The patient, I call him James, rushed to the ER the next morning. He was fucked. His head had grown 3 times its normal size, and his face was covered in warts that oozed a gelatinous green pus. On top of that, every tooth in his mouth literally exploded. He was rushed to a COVID-19 isolation ward where over the next several hours he grew fur from his head to toe. He looked like Chewbacca, our source said. French billionaire and Moderna CEO Stephen Bancel refused to believe his company's vaccination was responsible for James' sudden transformation and allegedly told clinicians that medical screening must have missed an underlying condition. He decided at once to strike any mention of the incident from public record and caution employees against violating signed non-disclosures and non-disparagement agreements. Bancel donated an undisclosed sum of money to several hospitals administrators in exchange for their silence, promising that James' case would be an isolated incident. Ain't that something? But 2 weeks later, it happened again. A 32-year-old woman checked herself into a local ER after coming down with a case of the fits after getting her second injection. While under observation, the female patient grew tufts of hair on her back and boils on her face, and days later her cranium doubled in size, leading physicians to believe she had contracted a rare tropical disease. When her fingernails fell out and she grew talons, the staff knew they had a serious problem, our source said. The woman got violent. She could no longer speak, not as we understand speech, and began clawing at hospital staff. They restrained her, but not before a nurse was grievously wounded. The woman was flown to the same place as the first victim. I believe they've expired, though I'm not certain. Moderna's upper echelons, he added, concluded that a potential side effect of the vaccine is biological regression, or monsterism, an irreversible process by which a Homoasian devolves into a Cro-Magnon or Neanderthal. The $28 billion pharmaceutical conglomerate has buried evidence of monsterism to prevent its stock, which has quadrupled in value during the pandemic, from tanking. This developed story will be updated as it appropriate. Man, look at here. Vaccine. Go get your vaccine.